There's nothing like being the lucky last. Or should we say, they saved the best for last.
Absolutely.
It's been an inspiring day hearing the journeys, achievements and outcomes of many wonderful teams involved in the Essential of Care program. It's been really a motivating day for me personally. Anyway, we would like to share with you our experience in the operating suite of becoming unstuck. From my perspective as a theatre nurse, having worked in the environment for many years, and from Simone, now the program coordinator, and previously as a member of our staff. The aim of this presentation is to share with you the journey of the TLC EOC program in our operating theatre. We will explain the challenges that slowed us down, explore the strategies that the team put together, discuss the outcomes, and hopefully, through our story, we can offer encouragement to other individuals and teams also to become unstuck. Just to clarify something though, before I proceed, in our network, the Sydney Children's Hospital Network, we use an integrated model of the Teamwork Learning Change TLC and Essential of Care frameworks together. The TLC model incorporates all the elements of the EOC Pediatric Family-Centered Care Framework based on the work of Professor Valerie Wilson, with a focus on facilitating teams to work together to create their own family-centered care philosophy. Both of these TLC and Essential of Care are underpinned by the practice development principles. Just to give you an overview of our work environment and workload, the Children's Hospital at Westmead is a tertiary teaching hospital with pediatric referrals within the state, interstate, and internationally. The perioperative unit has 10 operating theatres, which incorporates 16 surgical and medical specialties. A large cohort of 108 nursing staff that also covers the cardiac catheter and interventional radiology lab, MRI and oncology treatment center, which is unique compared to other hospitals. We need to consistently work as a team. No case can be done on our own. Multidisciplinary communication is imperative. We do a lot of amazing things at work, but no case can be done on our own. Oh, did I say that? I did too. We do a lot of amazing things at work. We operate on newborn babies that weighs less than a kilo with a very little airway, and sometimes we might use microscope when we do liver transplants in the middle of the night. At times we feel very special having to work closely with such amazing, talented, and well-known hard-working professionals. At times we can feel very tired working with too many specials. In times also, it can be very busy. It feels like a production line doing one case after another, keeping up with KPIs, with no other time left to do or to talk about apart from surgeries. Last year, we saw 14,402 theatre attendances, with 41% of those being emergency cases. So you can imagine the uncertainties that we face, the stress levels and ongoing collaboration with so many teams. It can be a very tough environment. And I can go on, but I won't do that. Next slide, yes. This is now our timeline, TLC EOC journey from when we started and to where we are now. It was introduced to our unit in 2010, and it took 2 years to progress from preparation phase to assessment phase. I mean, that's a very long time, needless to say. It started with orientation and information sessions with the management team and staff. 2 internal facilitators were identified. 1 session per month was made, regular from then on. However, during the values clarification and claims concerns issues sessions, strong reactions among many staff gets ignited most of the time. There was a sense of frustration, anger and defensiveness produced from discussions about practices and the way things are done around here. Feelings of powerlessness about the issues that were raised were expressed. A negative atmosphere surrounded the process. People were apprehensive about the sessions, some not wanting to speak up, and others speaking up very loudly and unconstructively. And this is where we became stuck for a long time. But then, as soon as we got over the assessment phase 2 years later, the venting of all those frustrations and issues seemed to have worked for us. As you can see, in the second half of the timeline, it took less than 2 years to move through 4 phases of assessment, feedback, action planning to implementation with the same amount of session, just one session a month. Assessment phase was a turning point of progress, and the culmination of number strategies resulted in rapid progression all the way through the implementation phase. For the last 2 years, there has been more movement and a lot more engagement from the staff. So it's a really interesting timeline indeed, and it does show a light at the end of the tunnel. I will now hand you over to Simone to talk more about in details.
Thanks, Reza. So the reasons for the stuckness will be familiar to most of you. Just give you that in case I break it. Perioperative nurses are generally adept at coping with change. There's continuous advances in surgical technologies. There's always new machines to learn and new ways to do things. Investigation into workplace culture, though, as Reza said, looking at the way things are done was met with a great deal of resistance. A high proportion of long-term nursing staff who were very passionate about their work and their workplace, but were very stuck in their ways. People wrestled with the new structured approach of TLC-EOC, which led to suspicion of the process itself. Staff tended to focus on issues that they couldn't change, causing a sense of powerlessness, as we have mentioned, and then this constant feeling of why bother? We're going around in circles. So this was compounded a bit by senior nurse perception that for the program to succeed, that they were to stay out of the way. So there was very little leadership engagement at all at that point. And being a large department, as those of you who are in large departments know, with multidisciplinary teams meant that it just took longer in general. More time is needed for communication and to get input from everybody. Operating theatres is a busy place, as Reza described to you, and along with other departments are expected to do more with less, with the targets continuing to increase along with the acuity of the patients. So TLC-EOC was set against the backdrop of a hectic environment with busy staff. Not having the same staff present at each session also sort of generated a further challenge to maintaining momentum and increased time, meaning that sometimes sessions had to be repeated many times over to actually have access to those staff. And whilst we started off with 2 facilitators early on, both stepped down from the role, and there was difficulty in recruiting, which meant that we were left with no internal driving force for quite some time. So, the critical element to becoming unstuck was the effective involvement of the leadership team. So clarification of their role, establishment of regular meetings and effective communication lines, and importantly, attendance at the sessions, produced a real definitive impact on the progress of the TLC-EOC. It assisted in shifting the mindset of the staff, and leadership team support was now visible, and this added weight to the process. Their insight into the unit and its cultures encouraged strategies that were going to be more beneficial in that particular culture were to be used, so that really went well. And that doesn't mean that they took over the whole process, but just that there was now an internal, a strong support structure in place. Communication strategies were strengthened in a number of ways. We had a discussion from the nurse manager with the staff to let them know about actions that were underway at a higher level to attend to the issues that had been expressed by the staff that they had no influence over, to let them know that things were moving. And that allowed them to put their focus onto things that they could actually influence. Regular updates on TLC initiatives via an information board, regular emails and discussions also helped increase the motivation and involved in keeping the TLC-EOC on the agenda. Insisting on adhering to the agreed ways of working and setting limits, which meant that in a respect and acceptance of each other, was enabled participation from the less vocal people in the and to feel safe in an environment where the discussions took place. And as Ressa mentioned, that was often not achieved earlier on. Bringing in the circle of influence and circle of concern was also... Really? Okay. I know, it's nearly home time. Was to address the sense of powerlessness, that in conjunction with the discussions from the nurse manager. Consciously using critical reflection and lateral thinking meant that the approaches taken were adapted to the needs of the unique team, as I just discussed before. And one of the issues was trying to find time to get the staff out, and it was interesting to see that from the other operating theatre person that was up here earlier. They had a similar issue. Ours was looked at slightly different in terms of ours was half an hour a month allocated prior to the start of the shift, which meant that there were no patients in the operating theatre at that point. And that was set long term, so a year at a time, and that was set in stone. So even though that seems like it may not work for some units, it worked really well for the operating theatre at the kids' hospital. Participation in data collection, and specifically in the observations of care, increased the enthusiasm. It meant that they acknowledged that data coming from them was good and that it was empowering to them. And working with the themes, the emerging themes, had a positive effect on the energy. So this is just a bit of a poster to show you some things that were done in each of the sessions, and points out the 4 themes that were emerged from the data collection. Communication, patient focus, team and education. And the first to be implemented was the communication trial, which looked like this. It was a simple strategy devised by the staff to address the issue of getting relevant information in and out of each individual theatre effectively or efficiently. So information about the patients, the running of the list, instruments, equipment, anaesthetic considerations, all the things that have impacts on the efficiency of the room and the safety and the experience of the patient and their family. So the idea was that each operating theatre was to have a meeting at the beginning of the day with all of the staff, and to identify one person that was going to be the point of call, or as they tended to become known affectionately as the POC. So they were the ones that were going to be responsible for receiving information from the floor supervisor and giving information to them as well. Initial evaluation was positive, but it suggested that some changes need to be put in place, so it was trialled with those in place. And the second evaluation was again positive. You can see in the chart that overall daily scores when using the POC were rated as above average to excellent, and that's in the red and the green. And that's resulted in the strategy becoming part of everyday practice now. The team are now preparing to embark on the next action plan, which is around patient focused, and that's going to be looking at the process for calling for patients and the waiting time from when they're called up to theatre to when they actually make it into the operating theatre, which, as you can imagine, in a paediatric environment can be quite stressful for fasting children and their very stressed, anxious parents. Okay, so outcomes. What did we achieve from 4 years of TLC EOC? So there's a raised awareness of the importance of the role of communication in teamwork and the patient journey, and we now have a new strategy in place. Evidence of positive changes in workplace culture. The atmosphere around conversations, examining practice is not as defensive or as highly emotionally charged as it was. It's still a work in progress, but there's more permission for critical discussion and a greater willingness to examine the way things are done. There's an increased consciousness of staff to issues around patient care and a sense that they feel more empowered to participate in those improvements. There's a greater insight from staff in just how tricky change is, and that it takes time and energy, but that it is possible. And a great sense of accomplishment and a strengthened team cohesiveness is observable in comments made by staff. So this is just a bit of a collage of some of the feedback and comments that staff had made at a recent TLC EOC barbecue breakfast. Ting ting, I'm coming. Just to celebrate how far they've come, and food is definitely one of those things that theatre nurses, and I don't doubt that most nurses like, and so it's always always get good response there. So I just wanted to point out that these comments acknowledge the change process and the benefits to the team and the patient care. A standout comment for me was that after participating in small groups, nurses that didn't normally interact with each other then would seek each other out in the clinical environment and do that for both work purposes and for a catch-up, which was nice. They can see movement and they're trying to make things better for themselves, the team and the patient. Finally, we're on our last slide, everyone. Okay, we just wanted to show you with this slide some of the passionate nurses and give you an insight into the atmosphere in the unit. Some are more formal, doing their job, and some are more sort of the social side or the fun side. One of my favourites is one on the right, showing you managers communicating with each other, and one is a fairy. You don't see that in every hospital. It just gives you an insight into the dynamics about providing care with a friendly paediatric touch. So far we've focused on where we are now and looking backwards with a celebration of the journey and the progress made. So obviously, maintenance of momentum, implementation of change and their thorough evaluation will need to carry on so that the team can continue to learn stuff about themselves that they didn't know, talk more freely about their practices, linking directly to improvements in service with the children in their care. Thanks for your time.